Welcome to all. Sexually transmitted diseases or infections can be defined as the infections caused by germs, which are like parasites. There are many different varieties of sexually transmitted infections like trichomoniasis, chlamydiasis, gonorrhea, um, herpes simplex, or HIV, hepatitis, and many more. Sexually transmitted infections can be defined as infections caused due to germs such as bacteria, virus, fungi, or protozoa, which are transmitted from one person to another person mainly through sexual mode. Reproductive tract infections are those infections related to the reproductive system in either males or females. Reproductive tract infections mainly encompass sexually transmitted infections, because major portion of sexually transmitted infections are the disease burden to the reproductive tract system. In general, around 340 million new sexually transmitted infections, which are also abbreviated as STIs, occur every year around the world. And out of this, 75 to 85% of new STIs occur mainly in developing countries. India is also situation in India is also not too different. Around 23 to 43% of women and 12%, 4 to 9% of men in India have STIs every year in India. Most of the infections in India are trichomoniasis, chlamydia, gonorrhea, and syphilis, as well as chancroid. Around the world, around 180, approximately 180 millions of people suffer with trichomoniasis, and around 120 million due to chlamydia, and 90 million due to gonorrhea, and 12 million due to syphilis. And the major symptoms in STIs being urethral discharge or painful genitalia, ulcers or swellings in genitalia, and disformation like discomfort and abnormal shapes of external genital organs at times, which may lead into discomfort. And if untreated, it may also lead to infertility and other permanent problems due to STIs. Major symptoms in STIs or RTIs are like urethral discharge, burning micturition, painful external genitalia, or pain during intercourse, or at times like warts and genitalia, and ulcers on genitalia, lower abdominal pain, etc. Itching can also be seen in most of the cases. But if untreated, the STIs may lead to permanent disfigurement of external genitalia, or foul smelling discharges, etc. And in long run, they may also lead to infertility and strictures. Situation in India is like because of the advent of HIV in India as well as around the world, the STIs has become a major issue now, because if HIV being one of the sexually transmitted infection mainly, and then the mode of transmission being the same for both the STI and HIV, if STI are not treated properly, the STIs may lead to abnormal mucosal membrane and increased infectivity in the vaginal mucous membrane or on penile mucous membrane, which may lead to increased infection with HIV virus also, and that leads to increased HIV incidence among the population who already have STIs. Prevalence of symptoms suggestive of STIs in India is around 23 to 43% in women and 4 to 9% in men in India. And a community based survey, multicentric study by ICMR, Indian Council for Medical Research, in collaboration with National AIDS Control Organization NACO, has shown that at least 6% of people have STIs at any point of time in India. 6% of adults have STIs at any point of time in India. And if we see the HIV prevalence among STI cases, in high prevalence states in India like Andhra Pradesh, Tamil Nadu, Maharashtra and Karnataka, if you see, around 16.4% of STI cases have HIV in Andhra Pradesh, while more than 15% of STI population has HIV within Mumbai itself. It's the HIV prevalence among STI cases amounts to around 12% in Tamil Nadu and 12% in Karnataka and around 8% in Tamil Nadu. The main risk factors for being a target for sexually transmitted infections is unprotected sex with multiple partners, and then not having good genital hygiene, and especially this risk behavior even increases with migrant labor and workers, those people who use injectable drugs, the injectable drug users, and inmates of jails at times, and then slum dwellers. Because of poor genital hygiene, the chances of sexually transmitted infection increases, and also lack of awareness about STIs and utilization of health services or health seeking behavior. Lack of health seeking behavior also are some of the main reasons of not treating the STIs in time at right time or at the initial stages, and then most of the cases come to the hospitals in late stages where already some damage, some amount of damage might have already happened to the reproductive tract system. And not treating the partners is one of the major reasons of recurrence of STIs in majority of the patients we have seen. Especially for the adults and adolescent age group people, the most important things to remember to prevent the sexually transmission infections are the A, B and C. A stands for abstinence, which means try not to have sex before marriage, and B stands for be faithful. Be faithful to one partner who is a legally married partner, which will reduce a lot of propensity to the sexually transmitted infections including HIV, and C stands for correct and consistent use of condoms. Not only using condom, but it's always empirical to know the exact way of using condoms, and consistently using the condoms is very important. Most of the time the misconceptions related to condoms, like people may feel using 2 condoms or gives more protection, but it's not true in reality. Having 2 condoms may even lead to falling of the external condom in female genitalia because of the lubrication in between these 2 condoms, and then lead to complications related to reproductive system in females. So, it is suggested not to use 2 condoms, but learn the technique first and use correctly and consistently.